we are going to just open up a discussion about the current events that have been happening related to Medicaid cuts. We'd like to get your thoughts, but also share some information with you. And then later on in this meeting, we'll also want to hear your input and thoughts and what you need from CHW Circle. How would you like to receive content through this space? This is a space for CHWs where we can share peer connections, but as well as network and learn from one another and other professionals in the field. So we'll get your input about that as well. We want to make it a space where folks are feeling welcome, but also a space where folks are feeling that it's safe to share and where you can learn things from one another. And so I'll pass it over to Rachel.
Okay, I'm very excited about this. So I've got a little PowerPoint, and we've got some interactive parts of the PowerPoint. So I'm going to share my screen, and you'll see at the top of my PowerPoint screen. Can you see? Does it look right? Does it the
Yes.
presentation mode? Okay, great. You'll see there's a QR code at the top of this. If you scan that QR code with your phone, you will be able to participate in the discussion through your phone. So as the slides advance on the screen, it'll also advance on your phone. Some of the slides have content and some have interactive pieces. So that's an opportunity. It's an option. Folks do not have to participate in that way. Anytime I ask a question on the PowerPoint with interactive options, you can interact with your phone, or you can just unmute and shout out, or you can stick your responses in the chat, and my colleagues Viney and James can let me know what those say, because I won't have eyes on that. So we're going to talk a little bit about federal Medicaid cuts. I think just to start out, to level set so folks know what we're talking about, Medicaid is a insurance program that is funded by both the federal and state governments of the United States. A lot of the funding comes from federal governments, but states have a lot of discretion in how that money is spent. So what has just happened is that the federal government, the US Congress and the president have signed a law that cut Medicaid in many ways and changed some requirements of Medicaid. It is very confusing because the system is confusing. It's also confusing because certain parts of the law they made confusing on purpose, in my opinion. And they've also made it so a lot of what the hard decisions that will have to be made by states and counties. So some of the stuff we might not feel right away, and some of the stuff might not be obvious that it's because of federal cuts. So I found a really great fact sheet that was published before this final bill was finalized. It was published when the House passed their version of the bill a few weeks ago. So there's a few changes. So some of my citations might differ a little bit just because of, or some of the numbers may be a little bit different because of the shifts that happened with the Senate bill. But we will send out this PowerPoint with all of my citations so folks can read for themselves. But the name of this Minnesota Department of Human Services fact sheet is Federal Medicaid Cuts, an Obstacle Course of Red Tape, Hurdles, and Traps, Pushing Minnesotans Off Healthcare Coverage and Driving Up Costs. So a lot of the things about this plan or this law don't actually change who qualifies. There are some changes to who qualifies for Medicaid, but a lot of it is changing how you get access to Medicaid by intentionally making it more difficult to access. So we'll go over that soon. But I really love this title so much I couldn't come up with something better myself. So I just put it in quotes and stole it. So first, I want to ask the group, and again, this is something you can use the QR code to post responses, or you can just shout out or put in the chat. What do we already know? What does this group already know about the federal Medicaid cuts? If everybody knows a lot, I can go fast. And if folks, it sounds like a lot of folks have been trying to keep away from it because it's overwhelming. So if anybody wants to throw in their own comments, what do you already know about these cuts? So UCare has cut Medicaid from 11 Minnesota counties. There's a delay after the midterms. UCare cuts, not enough, but still enough to affect my sanity. Foreseeable outcomes. It will affect our community. So there's some things we know here, right? The UCare has been in the news here in Minnesota. So next, I'm just going to go to the next slide. And this is about, we already went over this a little bit, but this is sort of how are we feeling about the Medicaid cuts how do we feel as we enter this conversation? I know we talked about feelings with our colors a little bit, but if folks want to throw down some feelings, you'd be welcome to. Okay, so nervous, worried, discouraged, scared, sad, frustrated, uncertainty, disgusted, despair, grim, hurt, sad, disappointed, unsure. So these are some big, rough feelings. Thank you for sharing that. I just want to kind of ground us in where we're at. So the next few slides is just going to be information about what do we know. Again, you'll see little citations. I'll send out this PowerPoint, or ask James to send out the PowerPoint slides that will have the citation. All of my citations are links in the notes of the PowerPoint, so I will send out the actual PowerPoint instead of a PDF so you can see these notes. But it's aimed at reducing federal Medicaid expenditures. It introduces administrative hurdles and eligibility restrictions. So again, the administrative hurdles piece is meant to get people to mess up in some way and get themselves kicked off. And they estimated the $500 million annual loss of federal funding for Minnesota. So that includes a 10% FEMAP reduction for states covering undocumented individuals. Minnesota does cover undocumented children. So that'll be $330 million a year. Ban on federal funding for gender affirming care. Moratorium on new provider taxes, which threatens our funding model. We'll talk more about the new provider taxes later. I had to do a lot of research on that as I was preparing for this because I did not know what that means. And then limits to retroactive coverage for 1 month. So all of us, many of us have used Medicaid. I was on Medicaid for several years, and many of us have had the experience with ourselves or our participants in our programs where somebody was uninsured, we got them on Medicaid, and they were able to have their bills paid 3 months back. This new bill means they will only be able to pay bills 1 month back. So there'll be higher medical debt and worse outcomes for families. Okay, so then just impact on Minnesotans a little bit more specifically. We could have 250,000 people lose their Medicaid coverage. There are 9,300 jobs at risk. So healthcare support workers, that might include some of us. There's going to be work requirements and eligibility checks every 6 months. So we all know how easy it is for our participants to get kicked off the program if they miss that year annual renewal. This means that will happen every 6 months. And one of the things they did during COVID was eliminate those renewal periods because they know that people who do qualify get kicked off if they don't turn their paperwork in appropriately with renewal. There will be higher out-of-pocket costs. So instead of everything being free, a doctor's visit might cost $35 instead of be fully covered under Medicaid. Counties and hospitals will face lots of added costs. Greater Minnesota hospitals are especially vulnerable. There's a huge cuts to family planning services. I heard some SMOC folks on the call. There's family planning is specifically called out as for these cuts, and that's $170 million a year. And then there's going to be what is being called an enrollment churn. So that is folks who are getting like churned out of Medicaid just because they didn't do all their paperwork perfectly. And then again, those who are able to remain on Minnesota Care or Medicaid will have to pay out of pocket instead of things being fully covered. Potential impacts on our profession. So one thing we've always talked about is that reimbursement rates for CHWs are not high enough, and there is a potential for the reduction of reimbursement rates. So one more thing to just emphasize is that this federal bill did not determine or change reimbursement rates, but they've created a situation where Minnesota is going to have a lot less money, and our state legislature and our counties are going to be forced to find money somewhere, either by making their own cuts, by reducing, and one of the things they could do is reduce reimbursement rates to save money across the board. So where we've been advocating to increase reimbursement rates because we know that they're not funding the CHW profession, this bill could non-directly impact those reimbursement rates negatively. There's program instability. We all know that CHW programs some are dependent on Medicaid, some are dependent on other funding sources, and there's a lot of uncertainty. And then increased administrative burden. So, new eligibility and verification rules are going to double workload for county employees. We all know that county employees don't have a lot of extra time. I've spent a lot of time trying to help folks I work with navigate county systems, and those folks are already overburdened. But if there's going to be work requirements for certain people on Medicaid, so there are going to have to be people who take those proofs in, and verify those proofs. And I don't think there's not funding to hire more people, and then there's a huge threat to rural hospitals. So rural hospitals may close, which could increase the distance of travel to receive care, which we already know is a huge problem, especially in northern Minnesota and all over rural Minnesota. Community consequences, all of us care about our own profession, but all of us got into this profession because we care about our communities. We know what this is going to look like, We've seen this. So there'll be access gaps. People will lose access to culturally competent care. there will be wider health disparities, and thousands will lose health insurance and access to preventative care. So the worst impact, as we know, always is on the most marginalized communities. So Minnesota has been working really hard, especially since 2020, to try to reduce gaps and health disparities, and this is going to sort of exacerbate those. And when can we expect to feel impact? So this is my last sort of lecture-y slide. There's some immediate impact. As I said, reproductive care was very much targeted, and Planned Parenthood was targeted specifically. So Planned Parenthood North Central states, so that's Minnesota, North Dakota, South Dakota, I think is Planned Parenthood North Central states. They've lost access to already. So a lot of these cuts are going to come later, but they cut off Planned Parenthood immediately. And it's $11 million in Medicaid's funds. And they've already announced clinic closures. And most of those clinics are in rural settings where there's not a lot of access to reproductive care. And then, as folks mentioned earlier, UCare has announced cuts to Medicaid coverage in 11 Minnesota counties effective September 1st, impacting 88,000 Minnesotans. And then just the longer term impact. And this is a quote from a CBS News article that I cited here. This bill is structured so that most Americans will feel the impact of tax cuts related to this bill in the spring of 2026. But some of the provisions, like work requirements for Medicaid, do not take place until 2027, which is after next year's midterm congressional elections. So this to me shows me that these folks knew they were doing wrong by this bill, and they wanted to make it look like wasn't them, right? So whenever you put the carrot ahead and the stick is later, it just feels really, that part feels really yucky to me. So now, with this new knowledge that I gave you, how are we feeling? Same feelings, different feelings? If everybody wants to, I'll pop this QR code again. Let me know if any of your feelings changed with this information. More informed. Still so mad. Yeah, me too, man. Any other feelings? I know we're doing a lot of feelings today. Despair, pissed off, nauseous. We do this in the word cloud so people can say pissed off and so they don't feel like they have to say it out loud. You're making me say it. That's all right. Yuck, angry, grim, despair. Yeah, so instead of feeling sad, we're now feeling a little bit more, there's a little bit more anger here. I like the emoji. I didn't know we could do that. Need to smash room. Infuriated. Yeah, yuck. This is really tough stuff. And I think the reason a lot of us have been avoiding it, and the reason that you may have been avoiding it on the news but came to this space, is that stuff like this is really heavy and none of us can carry it alone. So we are here to carry it together and to talk about where we do still have power. So there's a lot of powerlessness that can come when these things happen. And there's nothing that any one of us can do that will replace $500 million of federal funding, right? Like that is not something that we're not going to have like a chicken queue and raise $500 million for our communities. So it's really tough and it's structural stuff. But we are here together to move forward and to know that we aren't alone in this, and that you're not the only one who's angry, and you're not the only one who's sad, and you're not the only one who sees the negative impacts this will have on our communities. So the next question, to sort of turn that anger into something else, how can we as CHWs help our patients, help our clients, help our communities navigate these cuts? Like, what can we do on an individual level, and even thinking more broadly, what can we do collectively to move this forward? So folks can stick it with a QR code, or they can shout out, what can we do? Continue, show up, be there for them.
Sorry, I didn't use sorry, I just.
Yeah, shout out.
On the chat, yeah.
Yeah, provide information. Go ahead. Do you want to speak, Aaliyah, about what we can do, what you want to do with for your community in these times?
Yeah, I think a lot of people, a lot of clients and patients are frustrated. So definitely, providing genuine empathy, active listening, just stating that I'm here with you. I'm here to help. I'm here to help. I'm here to listen, and trying to be resourceful. Do anything you can and everything you can to go online and find resources, look for something, I mean, because it's just, yeah, even if you don't find anything while you're just searching on the web and trying to be resourceful, that gives them a comfort that someone is there for them, someone is working for them, just for them knowing that, it gives them hope. So uh, doing, I mean, yeah, everything. I'm currently not working, and I just got my certificate in May. Gratefully, I do have I'm invited to the Native American Community Clinic in Minneapolis tomorrow to do 2 hours shadowing for the as a registration coordinator. So I'm excited and grateful, and I do have a couple other ones coming up, interviews. So I want to invest my time and energy in underserved communities and do what I can, because without those communities, I wouldn't be here. I mean,
Yeah.
without the CHW, the Community Health Worker Alliance, without, I mean, other organizations, nonprofit organizations, I would not be here. And so I know what it's like to be neglected and ignored. So just
Yeah.
doing our best, all of us. That's all we can do.
Thank you.
Congratulations on your academic success, Aaliyah.
Oh,
Yeah.
thank you, thank you. I wanted to email you back, but it's just been like so much going on, and so I really appreciated all your emails and getting back to me. So I'm grateful to have you in my life.
Thank you.
Yeah. Wonderful. Okay, so I'm seeing a lot of things that I know CHWs do all the time, right? So it's just us continuing to do the work. And so I'm going to go to the next slide and just open it up for discussion a little bit too. So in my opinion, these cuts, especially because these cuts are meant to make it more difficult to navigate these systems, this means that CHWs are more important than ever. And so again, like I said, the federal cuts have been sort of decided. The state needs to decide what they're going to do and how they're going to reallocate funds to make this work. And I think we can all say loud and clear, they cannot cut us. Like, we are more valuable than we've ever been, and our communities need us now more than ever. And CHWs need to continue to be invested in. So the last slide was kind of what can we do for our clients, but I want to just stop sharing for a second and open it up to talk about what we can do for what can we do on a structural level to like advocate and make sure that we don't get cut as bad as Medicaid get cuts, and that we are still have our jobs so that we can help folks through this. So does anybody want to come off chat and talk about structural advocacy things they're interested in, or things they want to bring up to make sure that we are showing our value?
I was going to just add, in thinking about Rachel's question, also think about how does this news relate to your specific role where you're working at? Are you someone, a community health worker that assists people to navigate insurance? Are you someone who assists people to sign up for SNAP benefits or MNsure or anything related to social determinants of health when it comes to their finances? So think about all of those things within Rachel's question as well. I know for me as a birth doula, I may be needing to help some folks as a CHW to navigate their health insurance because their doula service is covered under Medicaid. And so in order to continue their perinatal service as well as to have their birth covered, they're going to need to have active insurance on the date of their delivery as well as prior to that. So I knew very early on when I got into the doula field that the CHW role aligns with that work when it comes to resource connections and the population that I serve. So that's one thing that I know that I will be facing through this news.
Well, and I think speaking of doulas and community health workers, especially in these rural communities where birth centers and hospitals may close, people are going to need doulas by their sides to tell them when to go drive 2 hours to get to the hospital, right? So in our rural communities, especially where there's going to be care closures, especially around reproductive health and those things, all these roles are just going to be so much more important than they've ever been before. So I'm going to go back onto our mentee here and just ask you guys, what do you need from the Alliance, from Minnesota Community Health Worker Alliance as you navigate these cuts? So I'll put the QR code back. You can use the QR code to, what we can do is rank these. So it'll show up on your phone and you can move them around with your finger and we can see what we all kind of, it's sort of a ranked choice voting activity. So folks want to move them around, see what you think is most important for the Minnesota Community Health Worker Alliance to support you. We want to hear that. And if there's something that you want the Alliance to be doing that is not on this list, we'd love for you to put that in the chat.
Rachel, I put something I would like the CHWA to consider.
Right?
Aaliyah wrote, low health literacy is a problematic for millions of patients, and medical terminology is very complicated, and medical professionals don't educate their patients or clients. You want to say a little bit more about that, Aaliyah, when you said that the medical professionals aren't educating their clients? Does that, in my mind, how I process that is that maybe they're not explaining things in a simplified way as far as
Yes.
education. When
Yes.
you talk about medical terminology, I completely agree with that.
Yeah, they don't use plain language. They use very like big words and someone who probably doesn't have a high school diploma. How can you expect them to really understand that massive medical terms?
Mhm.
So they don't use plain language. I'm not sure why. They already have the job, so I'm not sure what they're trying to showcase. But yeah, that's what I meant. I mean, they don't really. I think educating. Even sometimes I feel maybe the medical professionals need to be educated how to work with clients and patients, and they just stop using this complicated vocabularies of medical terms. Sorry, that's what I meant. So
And likewise, even with navigating the social service and human services systems, we're going to have some folks, obviously, who don't know how to navigate that system. They need to either have someone do that on their behalf or be educated on how to do that and to be self-sufficient in that as well. Sylvia says, I think as an advocate for the CHW role, I see the growing need for culturally aligned and accessible CHWs for the community. As the system becomes harder to navigate, the navigators become even more important leaders and resources. Absolutely, Sylvia.
Yep. All right, anybody else want to rank these guys? Looks like legislative advocacy was really high on this list. Because like we said, the state and the counties are going to have a lot of decisions to make, and they're really hard decisions. So I think making sure that your local legislators understand the power of CHWs and what you are doing in your community to make your community healthier is really important. And I think the Alliance can be a leader on that. So thank you for those folks who participated. So that's the last slide I have specific to the Medicaid cuts. And we just want to take the next 10 minutes or so to talk about the future of the CHW circle, sort of going off of what the Alliance can do to be most supportive of you. So I think I just want to open the space up if anybody has any last minute or last thoughts to share about the federal Medicaid cuts in this space, and then we'll go and do a few more little activities about the future of the CHW circle. Does anybody else have any last thoughts they want to share around the Medicaid cuts? Something that I started doing was reminding clients not to use social media and what their friends and family is saying as a news source. Yes, thank you. That was said in the chat. I totally agree. I think I did a lot of that during COVID with people understanding the vaccine and other COVID measures to use trusted news sources. And I think as community health workers, often people do trust us. And I was often able to use motivational interviewing and accurate information during the pandemic when I was doing home visits and meeting with participants. People really did change their minds, even with one conversation with me, because I was someone they trusted. And I think that's what community health workers bring to public health, is that we're trusted members of the community and people believe us when we give them. And then there's a hope that we would consider adding 1 or 2 health literacy course lessons to the certificate program. Yeah, that's interesting. So maybe adding to the CHW certificate program has a health promotions class, and maybe having more health literacy content in the health promotion to make sure that everybody's ready for that.
Yes. Yep.
Wonderful. Any other last comments before we talk about the CHW circle? All right.